Hello, girls. Hey, welcome to another chat. I always love having these chats. They're just really good to be, informative chats for women in our 30 plus age group, I think. So today we've got Truly Godfrey, and she is the manager of the Clinical Thermography New Zealand, and she is also a thermography technician. I freestyle these interviews. Nobody's actually expecting me to be perfect, so that's just as well. So thank you so much for coming along, and I'm so looking forward on hearing your expertise on this subject. Would you just like to tell the girls just a little bit about yourself and what qualifies you to speak into this?
Yeah, okay. So I'm a mother of four. That's my most important qualification. I started doing thermography work 11 years ago. My dad is a doctor. He's the doctor that brought thermography to New Zealand in 2002.
Mm-hmm.
So he's the one that's trained me in being a thermography technician. I've also trained with the German Professor Bertz from Frankfurt University, who developed the software that we use. So yeah, thermography is an interesting area of medicine, because in Germany it's something that the German government funded the research and the development of the program, and you can go to a hospital in Germany and have a thermogram or an ultrasound or a mammogram or whatever. There's not a lot of difference. So yeah, I think I've had pretty good training in it in that sense, but there is no formal training or formal qualification in New Zealand for it. That's one of the problems, I think, in getting it formally recognised. Yeah.
Okay, so just before we go on, I just want to explain to some of the girls who don't know. So thermography is just an alternative, or is it supplementary? Would you call it supplementary, or would you
officially an adjunctive test? So as well as.
Okay, as well as a mammogram or an ultrasound, you would want to have a thermogram. So first of all, would you explain to us what a thermogram is, what it actually does?
Yeah. Sure. And I think it's helpful for women to compare what a mammogram can and can't do and what a thermogram can and can't do. And then why would you have an ultrasound? How is that different? So that's a conversation I often end up having with women, because, I mean, obviously women who are nervous about mammography or don't like the pain, or for whatever reason they want to avoid it, they ring up, and this is a conversation I have a lot. So there are a lot of women asking that question, is mammogram right for me? Both the thermogram and the mammogram can be considered a screening test, in that they identify if there's further investigations needed, and the ultrasound is really a further investigation because it's more in detail. So when I describe it to women, I say a mammogram, it's like it's this way and it's this way, X-ray of the whole breast. A thermogram is this way only. So both of them give like a roadmap for an ultrasound, for a sonographer to investigate in more detail in 3 dimensions if there's a structural thing there. So the mammogram is an X-ray. It picks up little white dots where there's a dense area of tissue that could be a tumor, or it could be calcifications, which identify sort of breast disease and possibility of a tumor. So it's kind of like a pointer. The ultrasound then goes into that region of that breast, which has been identified in more detail, and measures how big something is and how thick it is and what the outside edge of it looks like. So if you have a cyst, it's like a smooth pebble. If you have a tumor, it's got these edges where things are growing, So, and the ultrasound can also look at lymph nodes. So that's something that a mammogram can't really get, because this is just the breast tissue. It's not going into the armpit. So the thermogram also, what the thermogram measures, it's not lumps, it's not tumors. It's measuring heat, and in particular the heat of the blood vessels, and any inflammation in the tissue where there might be hormonal inflammation or toxic inflammation, breast disease really, which can precede the tumor. So most women choosing thermography look at it as a way of identifying how healthy their breast is. Is my breast likely to produce a cancer? And that's kind of a useful thing to know, and that's why I say it's adjunctive. You could have a tumor and a mammogram will pick it up from the size of a pinhead. It has to be at least that big. The blood vessels that feed that pinhead-sized tumor may have been there for 5 or 10 years prior. And that's what the thermography is designed to pick up, that heat of those blood vessels that are growing. It's called neoangenesis. It's new blood vessels that a tumor causes them to grow. So they're not breast blood vessels, they're tumor blood vessels, and they have a different heat signature.
So how do you know the difference between a tumor or say, a cyst?
Ultrasound, usually. And
Okay,
then, and then if the ultrasound isn't definitive, they'll recommend biopsy.
okay, so sorry, and what I mean is, so if somebody goes and has a thermogram and that thermogram produces heat, how do you, as the technician, I'm trying to think of the words, the technician, how do you decide, okay, whether that would be heat for a cyst in something non-invasive or something like a
So
tumor?
the thermogram would identify the heat, it doesn't produce it. You know, I mean, it would identify the heat that's already there in the tissue.
Yeah. So the heat doesn't discriminate between a tumor or something less. So
It's
it just goes, there's something going on here and there's heat
yeah,
produced because something's going on.
yeah.
Now you go and get the ultrasound and they'll tell you what that actually is.
Yeah, so it's a doctor that does the analysis. So the thermography technician, myself, and there's 4 or 5 of us in New Zealand around the country that do the imaging. It's just like, you know, room having a photograph taken by this infrared camera.
Yeah.
We then send the data to a doctor who does the report. So the doctors would analyze that using the software program that measures how much heat is there. So there's a range of heat that's considered normal breast, you know, range.
Yeah.
And then once you've got a hot particular area of one side of a breast, or one area that's hotter than the rest or than the other breast, they do a contralateral comparison. The software does a lot of this to a tenth of a degree, so it's quite specific. If the heat is outside of that, what's considered that normal range, then they would say either, you know, along the lines of, this is actually really concerning and it's a good idea to get an ultrasound, or we should monitor this. Let's have a look at this in 6 months rather than, you know, and so then maybe we would repeat it in 6 months. If it's identical and the same and hasn't changed, then they might say, well, you know, it's probably okay. It's not a growing, developing thing. But if it has changed, then you know that you really need to have further investigations. Or so the doctors measure that with their training, with their experience, and with all the research that the German, you know, school did with establishing.
So in that case, they come to you, have their thermogram, and then the produced heat, or they've got heat. So you're going to send them off now and refer them to a doctor. What doctor? Is it just a general public hospital, or is it some specific kind of doctor?
It depends on the woman herself. Yeah. Some women, you know, usually we would try to engage them with their family GP and start there. Some women that come to us don't have GPs or don't want to. You know, it's unfortunately the political landscape with breast screening. You know, it's complicated. Some doctors are willing to work with us and they'll look at our report and say, well, that makes sense, I'll send you for an ultrasound. You know, others go, well, this is rubbish and thermography's never been proven, so, you know, that's crazy, you need a mammogram. And so those women that don't want to have a mammogram get treated like that, they run a mile, you know. So so we offer support to women to meet their needs, you know, however they want to approach it. We can refer women for ultrasounds, but it has to be privately funded. The funding stream in New Zealand starts with basically with the National Screening Unit through Breast Screen Aotearoa, and they have contracts where they, you know, they work with basically all the radiology departments in New Zealand, which are all privately owned, by the way.
Oh, wow.
So they kind of get to choose how and when they will and won't do certain things. So, you know, within the legislation in New Zealand. So the mammogram, if you have an abnormal mammogram, it entitles you to then have specialist care and an ultrasound funded by the National Screening Unit. That's the only way to get a funded ultrasound.
So I'm already hearing screaming in the background in my brain of people saying, you know, just go and get your damn mammogram because you're an idiot if you don't go and do that. So I know you can't, like, you're not going to give recommendations as to who should have a mammogram, but why is there an alternative such as thermography? Because obviously there wouldn't be an alternative if there wasn't some contraindication in your head about what.
Yeah, I mean, I really think all tests should be considered, not necessarily, you know, because each test has its strengths and weaknesses.
Yes.
Mammography can miss some cancers, and there's no denying that. You know, the websites over the years, they've had different ways that they've admitted this. The research, the literature's there. You can plow through the years and years of literature. Basically, a mammogram misses 1 in 5 breast cancers in the postmenopausal woman. And in women who are premenopausal or have dense breast tissue, it's 50-50 in some of the research. So anywhere from missing 1 in 5 to missing 1 in 2, depending on the breast density for mammography. So a woman might say, well, look, I've got a 1 in 5 chance of it being missed. I'm going to do something else and have a mammogram, have a thermogram. You know, that is one of the things that's considered. The research on mammography also shows an amount of false positives. So where a mammogram says, hey, you know, there's some breast density, there's some white calcifications or something here that we need to further investigate, go and have an ultrasound, perhaps a biopsy. In some of the research, it shows that half of those biopsies were unnecessary. So,
okay, so can I just hold you right there, because actually the reason, or how I got onto this and why I started investigating thermograms and all that sort of thing, was because of my own personal experience with needing to go and get a breast check done due to what felt like a bit of a scary lymph node situation. So going into having now what was I even going to say? Just explained that really well to you, and I don't know what I'm talking about. But having a mammogram, I actually investigated a lot into it, and so I watched quite a lot of interviews, and I listened to a lot of stuff. I went YouTubing, and I know people are like, oh, you dove down a rabbit hole and you got yourself all scared, and that's how you ended up there. But actually, I heard a lot of I read and heard a lot of information about things like biopsies and false positives and things like that. And so what would it matter if you have a mammogram and then you go and have an ultrasound and then they say, okay, we're going to biopsy that? Now, what would that matter? Wouldn't that just be like, oh, well, you're having a biopsy and that's going to test whether it's, so it's going to give you,
because you've got a diagnosis.
Yeah, so you're like, yay, I don't have it, or rats, I do, or whatever, but so what I was sorry, I'm not actually, my words are hard today. I'm a bit tired today. But what I read into was that when you start putting needles in things, you're actually aggravating, cells and things like that. So can you speak into that at all, or is that not your area of expertise? I just wonder if having a biopsy is like kind of quite invasive, and does it solve all the issues?
For some women, it's really terrifying.
Yeah.
I mean, the thought of having breast cancer can be terrifying. I've had a breast cancer journey myself. I've had biopsies. For me, it wasn't terrifying, and that's quite a rare thing to be able to say. That I had that. I've seen my histology where it says that you've got a breast, non-specific type carcinoma, estrogen, progesterone positive, all that. I've read that, and I've realized that was true for me for that time, and my body was growing a cancer. And I honestly didn't feel fear. I went into a mode of, how am I going to deal with this? What am I going to do? So I mean, I've got a really powerful story for women who don't want to follow the conventional path, because I live and breathe to tell the story. But also, I think that well-being, that presence of mind, that right to choose for me what was right, each step of the way. I really advocate for women to be able to make their choices. And that's the important thing for me, actually. And so I maintained that control for myself, and it was very empowering. So, and I apply the same thing to the breast screening, industry. I really feel that women should have the choice with all the adequate information. To have an unnecessary biopsy could be quite an insult. You don't really need it. And this was something, we've tried to get a study started up in New Zealand where we could offer thermography for free to women who've had a mammogram and they're about to go and have an ultrasound and a biopsy. Give them a thermogram, and let's see if the thermogram can identify the ones that did or didn't need the biopsy. Let's put it to the test.
Wow.
We were stonewalled with that application and not able to do that study, but that's another story. So the reality would be, if you could do that maybe we could save some women that anxiety, that pain, that trauma. And it is a puncture into the body. So, that's always a procedure with risk attached. And it doesn't really even measure the anxiety and the fear aspect of it. That I'd love to take the fear out of the breast screening industry, and turn it around.
Well, interesting you should say that you'd like to take the fear out of the breast screening industry, because one of the interviews that I watched was that well-known journalist. She's actually very good. I don't know if she's still a journalist, but Melanie, what's her last name?
Reid.
Melanie Reid? Yeah. Man, she did the most amazing story on mammography and the actual literature around actually breast screening, and she actually called them out on some pretty specific things where it was literally fear mongering inside the literature. And because she, it was in an interview process, and she actually called it out on this interview, and the lady who she was interviewing could not deny that it was just a blatant
Sure.
lie. Really, it was just a blatant
Well,
misinformation.
I think it's cherry picking of the data, which we all do, to suit our preference. But
yeah,
I think that was based on the Promise film. That's a UK production. Melanie, because I think we've got that on our Facebook page actually, a link to that video. But yeah, it was Professor Michael Bohm in the UK who rolled out the mammographic screening program in the UK back in the 80s. And after 10 years, he analysed the data and he said, look, I don't think we're saving enough lives to justify the harm and the potential harm that we're doing for women with these false positives. And the committee said to him, Michael, if we tell women the truth about the risk-benefit ratio, they won't come in for screening. Wow. So we can't do that. So he actually retired, he resigned based on that. Ethically, he couldn't sit with that. So I think it was all based on that documentary, the Promise film. Look, it's not to say that mammography doesn't have a place, and I don't want to bash mammography. Yeah. It's just that women ought to know all the pros and cons about it. And it's unfortunate that it's the only option that's available to women, because I think there are women for whom it's too painful. They're scared of the radiation. Yeah. They just don't want to go into that environment either. The institution, aspect of it, it's very clinical. So I think they should be given more choices and more information.
I agree. Shall we talk about that radiation aspect? Again, I'm not trying to I know that you're not the be all and end all of information about all of this stuff, but I'm just going to ask you, what do you know with regard to that radiation? Because that was one of the things that put me off, because I've actually always been into caring about my health and my kids' health and all that sort of thing. So that immediately I was like, oh, I don't know if I want my breast tissue squished.
It's a toxin. Radiation is a toxin, and it's accumulative. So on the Promise film, the radiologist there that was interviewed, he said that 10 mammograms should be the maximum number of mammograms a woman should have in her lifetime. Oh, wow. I mean, here we start at 45 and you go to 65. Every 2 years you have a mammogram. There's your 10. So, in that sense, maybe it's acceptable. I think the amount of radiation per mammogram can change depending on your breast density and the size of your breast. I did ring the who did I ring? I rang several women. I went through a chain to investigate exactly how much radiation is used, because I know when women ask about that, they get told along the lines of it's no more than when you go on an international flight, something like that.
Yeah, that's what I got told.
Yeah. So how much is that? How many rads? How many greys? And what is a rad and what is a grey? Who knows? And it took me 5 phone calls to get to someone who could answer that question, and I never really got a definitive answer. It's almost like nobody actually can tell you how much radiation you're exposed to in New Zealand.
And is it radiation, if you go on an international flight, the radiation's all over your whole body as opposed to condensed into your one, or 2 breaths.
Yeah.
So is it, so you
it's not my area of expertise, but I liken, women that have told me, and I think it's quite a good example, when you have a magnifying glass and the sunshine on it on an ant, it's quite, they feel like that's what it's doing to them, and breast tissue is sensitive. So
it is. I was actually really concerned about having a mammogram, to the point that I ended up not having one, and I had to be pretty focused on what I wanted, and that was to go straight to the ultrasound, and it wasn't easy just to get an ultrasound, so I had to sort of jump through a few hoops to get that, because they actually want you to go through that mammogram process first,
which gives them a roadmap for this, which is why they kind of need to know where are they focusing. The little thing that they put on your, on the gel on your skin, that's a transponder. They need to know where to point it.
Okay. So for me, I had a bilateral, complete, all lymph nodes and everything done. So that would cover everything, right?
Yes, it would. Although, to be fair to the radiologist who's interpreting that ultrasound, what what they're doing when they do that, they're sweeping through the tissue three-dimensionally.
Yeah.
So they could scan past something and miss it with an ultrasound. Not wanting to say that it's been no good for you, but particularly if you've got a lump or a zone that's of concern, they'll focus on that more, and it's more likely to accurately pick something up when they're actually concentrating on that zone.
Yeah, yeah. Okay, so let's just jump back a little bit to the false positive results from mammograms. And what are the kind of extreme things that can, I mean, I don't want to be an extremist, but what can be the worst case scenario with those ones who are false positives, and what happens if they you know, detect something they think it's a positive? What can happen potentially?
You could end up with cancer treatment you don't need.
Okay, like what kind of cancer treatment are you talking about?
Chemotherapy, radiation therapy, mastectomy, even not very often, might, you know, really rare, but
yeah.
We've got some documents from North America. They did a huge study in North America with 90,000 women, and the Canadian task force produced some documents that are quite good for 3 different age groups. They identify the risk ratio of that, you know, and it could be anywhere from 7 to 40 women who have unnecessary biopsies, or, you know, it's, yeah, out of every sort of 500, I think it was, but it depends on, I mean, what basically you've got to remember that every person in that chain is trying to do the right thing by you, and if they're going to err on the side of caution, they're not going to take any risks with your health. So if you're in a grey area where you may or may not need it, they're going to give it to you just in case.
Yeah, and fair enough too. Yeah, nobody wants to send somebody home without, you know, giving them an accurate diagnosis.
No, and if they're not sure, they're going to err on the side of caution and overtreat rather than undertreat, and most people would want it that way.
Yeah. It's actually it's an interesting topic, but what would so the scenario of you having a woman come to you for a thermogram, and you detect some kind of heat, and then you would refer them off to somebody else, maybe get an ultrasound. If there is nothing detected at that point, would you invite them back for some integrative health, or what does it look like if there's some heat happening, which means that indicates, like you said, some breast disease or something vascular starting to happen? How would you treat that? What does that look like?
Again, it depends on the woman, you know, and on her philosophy. We might team up with her naturopath or her GP if they're, you know, wanting to work with that person. There are other tests that you can do if it looks like a hormone imbalance causing, you know, so depending on where the heat is present in the breast tissue, the doctors get a bit of an idea as to what might, you know, they can suggest things. So the report will come out with an analysis of what's present, some suggestions as to the way to treat it, and a review date, you know, for a thermographic review. We don't chase women up and say, have you done that? You know, if they come back to us, we remind them when the review is due. And at that point, we'll ask the questions again about what supplements they're taking, how things are feeling, you know, what are they doing. Sometimes it involves lymph drainage and physical things, body work. Other times it might be a hormonal imbalance, so there might be some tests and some suggestions as moving forward with that. It's not really our place necessarily, unless they want to do a consult with one of our doctors to control that process. But I mean, I'm available on the phone for women to help interpret their thermograms, and you know, we've got literature that we send out, and got handouts with breast health issue, you know, things. And then the following thermogram could show an improvement, and that's something that's actually really neat to see. And you know, another thing that I'm, you know, that puts a smile on my face is women who ring me up and say, oh my goodness, my breasts don't hurt anymore, you know, which shows that their breasts are healthier, which is a good thing. So it's we're very much about choice, woman's choice, you know, informed consent.
And when it comes to, you know, because we're talking about integrative health now, where it comes to getting back to some healthy breast tissue, is that like a whole aspect of things? Is it like your diet? Is it like you said, movement and drainage and like supplements? Is it like a whole lot of different things to get you back to basics?
You know, the research on it's really limited. There are minerals that are really seem to be very linked to breast health, and they're the same sort of minerals that would be linked to, you know, thyroid, ovaries, the hormonal health. Iodine Uh, that's something that apparently 95% of New Zealanders are deficient in, along with selenium. So those two minerals work together, particularly for your thyroid, which is sort of the beginning of the cascade of hormones. Breast tissue has a lot of receptors for hormones, so they can get stuck there if the lymph isn't working, if there's congestion. So yeah, there's toxicity, different types of toxicity, and because the breasts are a fatty tissue, often the body will dump toxins in fatty tissue. So they're not really a filtering machine, but they can be a dumping ground. And there is some literature to show that women who have died with breast cancer have higher levels of mercury, lead, cadmium, tin in the breast tissue. So that's something we look at, with women with sources of that type of environmental toxin. Yeah.
Interesting, actually. That brings me to the question, which I have had people ask me personally, this a lot, because we, like the range of products that we sell are natural and plant-based and all that sort of thing. But deodorants with aluminium, is that part of a toxic load in breast tissue?
Yeah, it's one of the aluminium has been found in the aspirate fluid from breasts with disease. Logically, it would have to have an impact if you're blocking a natural process of elimination of toxins, which is what sweating is, in the armpit, where apparently you've got about 60 to 70 lymph nodes in the breast and the armpit region, and they've got a big job to do. It's a main freeway. There's a lot of movement of blood and lymph flow through the breast to the armpit. If you block that up, logically there'd be consequences from that. But again, there's not a lot of research sort of backing that up, which is a shame. It should be.
So deodorant's one thing, but antiperspirants would be another. Are they both as bad as each other, or would it be antiperspirant to stop you sweating? That would.
Yeah, the antiperspirants dry up the sweat, the aluminium, whereas the deodorants just mask the smell. So deodorant is safer. Yeah.
So deodorant's safer, but it probably still has its little bits and pieces in it. So
and you still get a wet pit.
Yeah. I think I'd prefer that, though. I just feel a bit like, I don't know, being a bit more natural. I don't think I'd be so natural I'd grow my armpit hair out, though. Sorry, I've got to draw the line somewhere. Okay, so what about, just to finish up, can you give us just some basic, this is not a consultation, but just some basic kind of health things that you can do to, just support your breast health? Is it eating? Is it exercise? What are the kinds of things that you would recommend?
Well, I think the breasts are part of the body. So, the specific things that the breasts are affected by is that hormonal, balancing thing. So that's probably the main thing is if you've got signs of estrogen dominance, you may not see all the consequences of that, but deal with it, and that's something that the thermogram can lead to. Often, we'll see that hormonal inflammation. And so that's something that naturopath would probably be the best person to go to for that kind of help. I think there was a study that came out that showed that wearing your bra more than 18 hours a day increases your chance of breast cancer. So you have to think, well, why would that be? It's probably due to the constriction of lymph vessels. So if you, most people that wear their bra like that have tender breasts. So there's an indication that there's too much estrogen. So fix it. Yeah. Pretty much in this world that we live in, most people need to take vitamin C every day. I think, it's very difficult to get enough out of the food that we eat now to cope with the toxins we're exposed to. So a daily dose of vitamin C, at least a gram, 2 or 3 even, is probably very sensible for everyone. And then watch your diet for those minerals, the selenium and iodine you get in the red seaweeds, selenium's in the organic Brazil nuts. That good to throw those into the mix. But think of breast as part of the body. It's it's not an isolated thing that you address. It's your overall well-being as well.
So in that case, is there anything that you would recommend avoiding putting in your body in terms of food wise, which would exasperate anything in your whole entire body?
My dad, Dr. Godfrey, he's been a GP. He's 84 years old now, and he's still consulting a little bit. He had a turnaround back in the 80s when he realised that the med school that trained him had gaps in what they taught the doctors about helping people to stay well. And the best thing he can say to people is to think about your great grandparents and their diet. So if they could have eaten it, it's probably safe. Since then, you know, anything overly processed.
Okay.
Yeah.
And just one last question. This is more specific for my own personal nosiness. But with iodine, I actually have had it before. But I mean, I guess it's a daily thing you take. How much do you take? How do you know what's the right dose? Because I've seen that question a lot.
Yeah. And iodine, there's actually a syndrome called iodophobia, which a lot of medical practitioners suffer from. You know, there's a lot of fear in the medical community about iodine. It can cause your thyroid to go, if you have too much too quickly or too slowly, conversely, you can end up hypo or hypothyroid, which is not pleasant at all. So taking iodine is something we do with caution. It's why I sort of, you know, I mean, we would give people the literature, say, do some research, look at your other symptoms, maybe team up with a naturopath or someone who could help you with this properly. Apparently the average Japanese woman will eat 12 milligrams a day in her diet with seafood and the seaweeds. So that's kind of the go-to, 12 milligrams, which is a lot compared to what the New Zealand recommended daily dose is. It's more like in micrograms.
So what would that look like in terms of drops?
If you've got full strength iodine, it would be 2 drops.
2 drops.
How dilute your bottle is, you know, that's so there's different ratios. Some women just paint it on the breast skin, so they let it soak into the breast tissue, and that's something that can reduce the pain in the breast tissue, which is
so like 1 drop each, and just paint it.
Rub it in, and it stains the skin, and then it soaks in, and your skin goes back to whatever color it was before.
Oh, wow, that's amazing. And I know that there's a contraindication with iodine and vitamin C, and you talked about having vitamin C every day. What is that?
Vitamin C will reduce the iodine into iodide.
Okay.
So you can mix it up with vitamin C, and you can still drink it, but it means you're drinking iodide, not iodine. So different body tissue requires a different format of iodine. Okay. So it's not going to hurt you, but it's not going to give you the iodine that you might need.
Got you. So just a little bit of separation between the two.
Half an hour.
Okay. All right. Awesome. What an awesome chat. I feel so much more informed. Can I put some links and things like that up? Is there anywhere that you can point women to go, or even if they'd just like to investigate this a little bit more, where can we find you?
Well, we have a website. It's a bit dated, but we're working on that. It's the clinicalthermography.co.nz. So there's some research on there and information about what a thermogram procedure is. That's a place to go. We've got a Facebook page, which, you know, sometimes we have interesting conversations there. You know, there's a lot of breast health Facebook groups that are worth investigating. The breastcancerconqueror.com, she's got some really good research that she, you know, she does more blogs, and she's more active. We're a bit of a small team here in New Zealand, and we don't have a lot of time to do the social networking, really. But so those are the 2 places I'd send people.
Okay, well, somehow I found you, so you must be doing something.
Visible.
Okay, so I'll have a look up some of those links, and I'll attach them to this when we put it live. But also, what's the cost of a thermogram, and where can you get them?
We have 15 locations throughout New Zealand that we get to. Only 4 of those are available every week, you know, that we live in the town that they're in. The other 11 we travel to on an annual schedule, which we repeat. Yeah. So you can get that information off the website or the Facebook page. It's $240 for a thermogram this year. It's going up next year along with inflation. If you are referred by a friend, you both get a 10% discount. So each new person that comes in with a friend, it's called the breast friend discount. You mention your friend's name, and you both get 10%. So that makes it $215, and that's also the senior rate, $215 this year.
Yeah, that's cool. Yeah. All right, and how often do they need to have those?
Depending on what the doctor says when they do the assessment. Yeah, I mean, most women eventually come every 2 years. every year. It's a tricky balancing act because there's no harm in a thermogram. There is no radiation. It's not painful. You can have as many as you like, as often as you like, and it's other than the purse, there's no harm done. Yeah.
Okay. Yeah. All right. That's good to know. Okay. Awesome. Well, thanks so very much for your chat. I feel very much more informed now, and I hope that the rest of the girls do as well. Thanks.
Yeah, me too. Thanks for having me. Really appreciate it.
My pleasure.